An international health emergency is in effect over an outbreak of an Ebola strain in the Democratic Republic of Congo and Uganda. It has killed more than 80 people so far in Congo. Fears of further spread growing when authorities confirmed a case in the country's biggest city, which is controlled by the M23 rebels. Meanwhile, the U.S. Centers for Disease Control and Prevention is mobilizing response efforts following an Ebola outbreak there, supporting partners withdrawing a small number of directly affected Americans. Earlier, U.S. media reported that a number of Americans currently in Congo are believed to have been exposed to suspected cases. The latest development coming as Congo is battling a rapidly spreading outbreak linked to the rare strain of the virus. It's a strain for which there is currently no approved vaccine. Clinical symptoms include fever, bleeding, and multi-organ damage. The disease has a fatality rate as high as 50 to even 90%. The outbreak in Congo has so far been centered in a province in the northeastern part near the country's borders with Uganda and South Sudan. Containing the outbreak there is complicated by the constant movement of people. There is a lot of gold mining activity in the province, which also suffers from regular attacks by the armed groups active in the region.
It is an epidemic that will spread very rapidly, all the more so as it has broken out in a densely populated province, with a high concentration of people and a great deal of population movement. And then, of course, there is the added complication that there are many armed groups in this province. That is what will make managing this epidemic very, very, very complicated.
And according to health officials in Congo, at least 88 people have died, while more than 300 suspected cases have been reported. The virus has also crossed borders, with Uganda confirming a related death. The WHO said the outbreak did not meet the criteria of a pandemic emergency, but there was a huge risk, there was a high risk that the disease could spread further to countries sharing land borders. Experts believe fruit bats are the natural carriers of Ebola, though interestingly the bats themselves do not fall ill. The virus can also spread through other infected animals like antelopes and porcupines before being transmitted to humans. Human-to-human transmission happens through direct contact with the bodily fluids of infected people, including blood, vomit, and other secretions. Traditional burial practices involving physical contact with the victims have also contributed to Ebola spread during outbreaks. Unlike some respiratory diseases, Ebola does not spread through the air. However, once infected, patients face a very high risk of death. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.